All right, let's review the muscles that are responsible for radioulnar joint pronation. So that is the radius moving over the ulna. Note that you have a muscle that is on the proximal part of the radioulnar joint and a muscle on the distal part of that radioulnar joint. Remember, it's a very long joint. The motion occurs in the horizontal plane about the longitudinal axis. So you can kind of see that it's moving, that we're looking in the horizontal or the transverse plane and about this longitudinal axis. So the two muscles that are responsible for pronation of the radioulnar joint, remember, do not confuse this with the elbow joint. Radioulnar joint is a long joint in your forearm and moves in the horizontal plane about the longitudinal axis in pronation and supination. So near the proximal part of the joint, you have the pronator teres. It's a more superficial muscle, median nerve innervation. And then at the distal point, you have this little square piece of muscle, the pronator quadratus, very deep muscle, also median nerve innervation. Some more details about the pronator teres. So the pronator teres is coming off the medial supracondylar ridge of the humerus and is angling down to the lateral surface of the radius. So based on line of pull, if this pulls toward the medial side of the humerus, that radius is going to rotate over the ulna into pronation. And again, it is a median nerve innervation. Pronator quadratus also has these angled fibers that is going to pull the radius over the ulna at the distal portion of this joint. So it comes from the anterior side of the ulna to the anterior side of the radius and is a median nerve innervation.